Hey guys, so if you struggle with postpartum mummy pooch, if your cause doesn't feel or look the same as it did after having babies, you might have diastasis recti. Now that's normal, a separation of the abs that happens to accommodate the baby as it grows. Your abs will separate and the linea alba gets stretched. That's a normal process of a child growing in the stomach. Now once we have the baby, it's meant to naturally go back, but 60% and higher people experience diastasis recti when the gap is left, and this causes back pain, pelvic pain, bad posture, pelvic girdle pain, stress incontinence, weak pelvic floor, bad breathing, which causes anxiety and stress. There's tons of things that this can cause. We really want to get it fixed, and it all starts with checking first to see if you've actually got it. So this test, you can get this done yourself, or you can go to a physio and they can do it for you. So first we're going to go over here and lie down. I'm going to lie down in the semi-supine position. So if you just want to come round to the side and you can see. So we're going to check for diastasis recti. So we're looking for a separation in the abs. So abs are nice and relaxed right now. And when we lift our head, we're going to engage our abs. Okay, and that's when we're going to feel for any diastasis recti. I'm just going to call it DR for now, okay? So when I lift my head, so we're looking for the linea alba. So it's a tendon that runs from your diaphragm all the way down to your pubis, and that's what stretches and holds the weakness there. So we're going to get our fingernails, and it's better if you don't have fingernails, and you're just going to push in, and when you lift your head off the ground, you should feel both sides of your rectus abdominis muscle, your six-pack muscle. You've got three and three on either side. You should feel it come together, shortening the space and pushing your fingers out of this gap. So relaxed, pushed up. So that bit is fine. So you can see the depth as I've got my head off the ground. The depth, you can still see my fingernails. There's no diastasis recti there. So where diastasis recti normally is just above and below the belly button. I have it here, so you're about to see what it actually looks like in the depth. So it's something I'm working on now with the TVA, which you can check out my other content. So I'm just going to push in. When I lift my head off and feel my abs engaged, you can see that you can't see my fingers getting pushed out because it's a bit squishy. I have a tiny bit of tension, but you can see like it should be a lot higher up, and you can also see the skin is different around this area. So diastasis recti is present there. And let's check for the lowest part of the abs, which I have been engaging. I did have it there as well, and I've been working. So we're looking for that gap, so get to know how it feels, especially if you just had babies. Lift up. And that's a lot of tension, could be better, but that's feeding in from this part of the diastasis recti. So, like I said, so diastasis recti isn't here, and you can feel there's tension, and when I lift up, it's pushing my fingers out. It feels firm and toned, whereas lower down, like from the belly button down, there's obviously a weakness there. So what you are wanting to feel over time is tension, firmness, and your fingers getting pushed out. So in the next video, we're going to go into exercises to strengthen diastasis recti, to bring the abs back together, strengthening the linea alba tendon. Leave us a comment on my channel if you've done this self-test, how you found it. And don't worry, it's not anything that you can't fix. You can always make improvements. Like I said, if you're 5 minutes postnatal or 20, 40 years postnatal. Thanks for watching.